So glad you could be here this evening. This is a very important program that we're going to go over tonight. This program puts together our last two classes. This program is going to be important for you to remember, but there's so much information. We've got a lot of handouts for you. Now, for those that are going to be watching this on the web page, we're going to have handouts that you'll be able to click on. But I want you for now to get your PowerPoint and get your pen handy, and let's go through these. Now, at church, asked some people, what would be questions you would ask? You're not a diabetic yet, but what would be a question that you would want to know? So these are people that are this side of diabetes asking, and they said a couple of things. They gave me a whole list. But one thing was, I want to know right now what symptoms I need to watch for. If my sugar starts getting high, before the doctor has an opportunity to tell me, I want to know what to look for. You need to know the same thing. Now, wherever you are on this journey, if you are pre-diabetic and the doctors put that in quotes, what does that mean? Or if you have diabetes that we call type 2, maybe on oral medication, or if you are insulin dependent and you've been given a different diagnosis of maybe type 1, wherever you are on the journey, or if you are trying your best to avoid the diagnosis altogether because it's raging in your family. Wherever you are on the journey, you must know symptoms. And so I hope tonight you will listen carefully and that you will just learn, and you're going to have some good information to take with you. How do I know if my blood glucose is too high or too low? There are some symptoms that are very exact. And once you've ever experienced either or those, you will always know when it's coming on. But there are a couple of symptoms that cross over. And we'll talk about those that you go, boy, if it's high or low, they have this symptom. I want you to know the difference. And then I want you, before you leave here tonight, I want you to know what can I do to stay healthy in regards to diabetes. So that's what we're going to look at tonight. And then there was a ton of other questions we could have gone over. Now, I'm trying not to gross you out with too many pictures. I promised our videographer that I wouldn't gross him out and he'd pass out because he's videoing this for us. But I want to show you a couple of pictures. This is one of them. Some people have asked, when was insulin started? How was it started? And how did they even come up with this? This is the first documented patient that received insulin for diabetes. I want you to look first at this is two pictures side to side. Of course, it's an old picture. That's why the pixel quality is low. But you'll see the mom holding her child, and the child looks emaciated, like they haven't eaten forever. Well, the reason is, one of the reasons with type 1 diabetes, they waste away. And so this literally would have died. And then they started, you can imagine the experimental for mom, but she was at her wit's end and started insulin, and look at that child later. So it's not like the same person, is it? So survived. Now, complications probably been totally different in the world in the 1920s, but I found that fascinating. This is also a young girl that had similar experience. Look at the picture on the left, emaciated, and would have been someone that you would have expected in like a concentration camp. But rather than dying in just a matter of a few days, insulin was started, and look at the girl going to school on the right. So we know now much more, and we have gone through an evolution of products, of medications, of even numbers. What is considered high? What is considered low? A lot of changes over the last year. So we want to know some exact things. So I'm going to look first at this. I want you to know without a doubt, and I'm not testing you, so you can relax. I want you to know without a doubt what are symptoms. Hyper means high. When my sugar, glycemia, gets too high, hyperglycemia, I want you to know these symptoms. So those of you that are already diabetic or pre-diabetic, if you find yourself having to go to the bathroom more and more and more, this becomes a routine for you. That's something you need to let your doctor know about. I don't mean that occasional time where you've been working out in the yard and you've drank a lot more, you're having to go and urinate more. I'm talking about it's becoming a real urge. I love this. I love the little code over here. Actually saw that on one of my trips in Europe, and I thought that's fascinating. They had fun little signs for the toilets. If I urinate a lot, also I might be thirsty a lot. If you're finding yourself having to drink constantly grabbing something to drink, and it may not be water, it may be a soda, it may be coffee, for some it's even alcohol, but to drink, even to wake up during the night and go, I'm thirsty. I'm thirsty. How you can tell, and that is alarm for the doctors. It's kind of like the true smokers, you know, because when they wake up during the night, they go, I need a cigarette. So for diabetics, and as the sugar gets high, you will even awaken being thirsty. So that's something I want you to be a note of. Another thing is, and this is more for type 1 we see, for type 1 diabetics, and you saw those 2 children, they will have unexplained weight loss. You know, for you and I, if we lost that weight real quick, we go, woo! But we might worry about cancer. You know how all those things you might in your mind go. We would see more of a weight gain. I'll explain that in just a minute. For the type 2, and particularly in that girth area, you know what I'm talking about, that magic area. So, again, unexplained weight loss for type 1 diabetics. Increased hunger. Now again, this is going to be, as my sugar would get really high, as your sugar would get really high, you can't be satisfied. You will eat, and it's not mealtime. I just can't be satisfied. I don't know why I'm eating again. So that's just one of the things, to kind of make a mental note of that. You might see vision changes that are far quicker than between your annual exams. I'm not surprised if I go for an annual eye exam if my eyes have changed a little bit, because I am well over 40. And so eyes do change, and particularly the reading distance. But when between those visits you're going, my glasses are not adequate anymore, then, you know, let your doctor know. You know, I've had a lot of vision change between my appointments, and it starts picking up. The higher your sugar, the longer it's maintained high, you're going to have vision changes. And the feeling of tired all the time, that may be all of us, worn out. But feeling tired and you really haven't done the housework or the yard work, and really you've just sat in front of the TV, and during a lot of that time in front of the TV, you fell asleep. Does that sound familiar to anybody? When we go to the bathroom a lot, and this is just a side note so you'll kind of have an understanding, your body is trying its best to get rid of the extra sugar that's in your blood. The way it does it is that you try to urinate it off. That's why you get rid of the water by going to the bathroom a lot more. More water means more urine. Then you get thirsty. Is this not a cascade of events? So now that I'm going to the bathroom all the time, then I'm getting more thirsty, and that will also cascade to being more dehydrated. We're going to talk about dry skin. And you go, well, dry skin's not going to kill me, but it's a little check mark that you can put. When your sugar stays high for a period of time, you'll notice a difference in your skin. And it's not a pretty difference. So that's another thing. It'll dry the skin as well. As you become more dehydrated, then you might lose weight. You go, well, that sounds good to me. No, it's not a healthy weight loss. It's not just fluid. You're dehydrated, but your body is not able to use the sugar calories. And so what it ends up doing is it's using other things, and then the weight loss is going to be dangerous for you. So vision becomes blurry when the sugar builds up in the lens in your eye. We'll talk about what that means is, y'all, we're given 2 of these, but I really depend on them. Do you? And I need to keep, I don't want to wait until I go, oops, they told me that might happen. And then you're trying to backtrack, because some of the side effects and the complications you can get with diabetes, you cannot backtrack on. So that's why it's going to be really important. Try to keep it so. The eyes and the vision. For a diabetic, you're going to have problems with your eyes probably earlier. And because of higher blood sugars over a long period of time. Let's look at some norms and some not. If you may go, I can live with a lot of that. I will go get my glasses readjusted. I will go and just drink more water. I mean, you have an answer for all this. Now you need to know, with that symptoms that you're having, will it have any damage to my body that I really need to pull an alarm on? Here are some of the areas that we need to be concerned of. And some of these you've already experienced. If my blood sugar is high and stays high, and that's what I'm living with, and I have concerns about some health professionals that give allowance to you more than others. We all may seek out that doctor that goes, I'll let your blood sugar get a little bit higher. But I have concerns about that. We're going to look at numbers and what this year goals are, because they have really tightened up this year. You will find that when you have a cut or a sore, and it may not be a direct cut, it could be something that's just wear and tear, like on a blister that has gone awry. you're going to find them take longer to heal. Typically, if you cut yourself shaving, I would suspect by that evening that it stopped bleeding. I would hope sooner than that. And I would suspect in 2 or 3 days, I can barely see it. But you may see a week, 10 days, 2 weeks. Why is it still there? And that's what you see when the sugars are staying high. Very deliberate, slow. The longer it takes for you and I to have a wound to heal or a cut to totally heal up, the more chance you're going to have infection. And then we're getting into a new category. Skin infections, you'll find women that have blood sugars that stay high are going to complain constantly of vaginal infections. And then we got to treat you for that. So here's a problem that caused a problem. We have to treat you with this medicine, where if we would keep our sugar under better control, we might eliminate that. I mentioned the vision changes. I'll show you a slide to give you a good visual of that. Nerve damage, now that's something that you don't want. With the nerve damage, it can cause your feet, excuse me, not just to feel cold, but to be real sensitive and painful. Anybody have a diabetic neuropathy that you know? And with that, boy, there can come some problem areas. One day it feels this way, one day it feels another way. I had someone at this church that often, on some days, I would see them. I was a little alarmed at first because the man had gloves on, and it was in the summer. But his hands were freezing him, and he said, it literally, Debbie, is so uncomfortable to pick up things. It's uncomfortable. And of course, they were trying some new medication to get that nerve feeling and problem under control. But sometimes when we get too far in the disease, it's hard to go this way. As you look at that, and as vessels and blood supply to your legs gets less, you'll find, and you thought it was just having another birthday, but you'll find that the hair starts being less. You'll kind of go, well, I don't need to shave my legs anymore, gals. And a lot of times it's going to be an issue of circulation. For men, erectile dysfunction. Now, that's usually when they'll call and I got to have an appointment, you know, because it's a real issue. So sometimes we pick and choose side effects when we need to look at everything because it can cascade down. Stomach and intestinal problems, and the chronic constipation is due to a gastroparesis, which means just as the nerves are damaged in one area, it can be in other areas and involve your intestinal tract. Many diabetics complain constantly of constipation. I just cannot get regular on this. Again, because of problems with long-term high sugars. Now, with this so far, I want to keep my sugar under control, don't you? So I'm hoping to convince you of that. If your sugar stays high, and as a nurse, I could pick this up in a second, but there is a classic breath of someone's sugar that's really high. And they always called it a fruity breath odor. But it is one that alarmed me, and I always said, I want you to sit down and let me get your blood sugar. But it's a classic breath. You need to know that. And so that if someone ever tells you, you know, and explain it even to the loved ones or your friends, if you ever smell this on my breath, let me know, alert me, and let's get a sugar check real quick. Now, the symptoms of being confused, that can happen with the sugar going the other way. So that's not a marker that we can always depend on. Or being drowsy. If my sugar got too low, I can get sleepy and drowsy and hard to wake up. Now, would I rather my sugar be too high right now or too low? You may have a different opinion depending on what you've had before. But know the symptoms so you'll know appropriately how to go. Now, if those are symptoms, now you think about that, you may go, I can live with the dry skin. I kind of like that I'm not getting as much hair on my leg. You know, you kind of go in this thought process and you pick and choose. But what does it mean if your vessels are starting to close up? Could it mean life or death? In some diseases, and it could. So let's look at the complications that can happen from some of these things. This is what you need to work with today, not next year. Because my goal for you, if you allowed me to set it, would be to avoid these complications. Let's look at those. The first three have to do with your vessels and have to do if they're going to clog up. I do not want the vessels that supply blood to my heart to clog up. You do not want that to happen either, because what that'll result in is going to be having a heart attack. And if the same time, if it were to, now I tried to star out some points here. In addition to the vessels in your heart, look up here in the carotid area. If I have blockage up in my neck, and that is that's called cerebrovascular disease, is the blockage is up there, and I'm going to be more prone to have a stroke. You know, there's these little lifeline screenings that go around all over Birmingham and all over the Southeast, where they check certain vessel areas. What we have found is often your doctor, my doctor, may not do a carotid study unless you're already having symptoms. And I'm kind of thinking, I want to know before I'm so bad that I have symptoms. But both vessels around the heart, and we've got some big old arteries that's supplying blood to our heart, and that artery is carrying oxygen. If I do not get oxygen to my heart, that part of the muscle of the heart will be damaged and eventually die. So please keep those arteries open. If I do not get blood supply to my head, it's the same thing. That brain must have oxygen, and without that, you could have that stroke. Now, and then peripheral vascular disease, just like it sounds, in your legs. And with that, you can have pain, you can have all kind of issues or problems. And if I don't have a good blood supply to my feet, and our feet take more of a beating than our hands. You know, I don't walk on my hands, but I walk on my feet. So that means if my shoes do not fit well, if I incidentally take something off and forget to put on my shoes or do not, then that becomes a problem when I cut or rub a blister or whatever. Or if that shoes are to die for. They are so cute. It goes with my outfit. It's wonderful. So what that they're a little bit too pointed, a little bit too high heel. And we will have women more than men have issues later in life because what we put our feet in. Now, I'm telling you all, wear shoes for comfort instead of style these days. And now, a lot of companies are making sure that they're both. You can get a comfortable shoe that is stylish. So let's go with that. But peripheral vascular disease can be a problem. Kidney failure, not only do I need a good blood supply there, but the kidneys themselves need to function. And when the kidneys do not function well, we're going to see other things. You'll notice your blood pressure starting to go up. You'll notice some other problems as well. So kidneys need to function. We've got two, but doggone it, seems like when we have a problem, it can ravage both of them. The visual sharpness we've gone over, neuropathy we've gone over, and then the poor fine motor skills. People that maintain a high sugar for a period of time, you'll find, and motor skills are more like picking up coins and, you know, fine stuff, threading the needle. And have you noticed any change in that? That if your sugar's high, you just have a little bit more problems with the fine motor skills. You've heard this. What's gingivitis? We don't want it. You do not want gingivitis. Okay, gum disease. Because, you know, you go, oh, I've got gingivitis, it's not a problem. Then you lose a tooth, and the second one, and the third one, and now it's 10. Now the doctor's talking about having to fit you with either dentures or plates and all this kind of stuff. We need to avoid gingivitis, and the way to do that is, of course, keeping up with your exams. But if your sugar stays constantly high, you're going to be much more prone to gingivitis. And you may start losing those teeth. I've mentioned constipation, I've mentioned gastroparesis, and then go to the other extreme of diarrhea. Urinary incontinence, none of us here want that. Orthostatic hypotension, and what does that mean? And diabetics, again, with the sugar maintained longer periods of time and just you're not getting it lower, you're waiting for the next exam in your doctor's office is about 4 or 5 months off. I'm just going to wait because it's so hard to get exams with him, instead of jumping on when the problems occur. Orthostatic hypotension means I'm sitting down, watching TV, and then the phone rings, and I get up real quick, and that orthostatic change, another positional change, and your blood pressure does not adapt well. You should be able to stand up and to begin walking and not have a dizzy, drunk feeling. But when you have orthostatic hypotension, you will often stumble on that first step, and you have to be very, very careful. So those are things to look for. What we're looking at on the thyroid, a lot of diabetics will also have an underproducing thyroid. I'm not going to ask you to raise your hand, but some of you in here, particularly with the percentage of women we have here, because it's more in women than men. And especially those women when they get over 50. I'm not pointing around who might be over 50 in here. But it is going to be important that you check the thyroid level. And because that will slow down your metabolism. If it slows down your metabolism, you go, well, that sounds good to me. No, because then whatever medicine I'm taking, whether it be insulin or another, then it may not deliver as prescribed, and your blood sugar may take a huge drop. So it's so important that your thyroid, if it's not producing well or not producing at all, that you take a replacement. So we tell folks to really watch that, and the doctor will know that as well, so to check the thyroid. Let's take a look at the eyes. I want everybody to keep their eyesight. I know you do too. So let's look at a normal and an eye that has retinopathy. And this is seen more often than they would like to see it. But in the first slide, which is normal, in the blood vessels, you may see that on your handout, but they're clean, they're neat, full blood supply, eye is healthy. What you're seeing on this bottom slide is going to be, and Sally, if you'll touch the lights, that might be helpful. I hate to ask you with your back. Thank you. But on the bottom one, and when the lights go down, you're going to be able to see it a little bit more. There's been some hemorrhages, and that's what we see with retinopathy, with the hemorrhage sites. And then sites here, we call these cotton wool spots, but it will literally become a vision spot, and we'll show you what it would look like if you had eyes of that today. And then these aneurysms, which is just the bulging of the vessel, and you do not want that to pop. So here we go, we're developing. This often is someone whose sugar has not been down in a while. We constantly have high sugars. So you might want to know, because none of you may have had diabetic retinopathy, but if you did, it would look something like this. So normal eye on the left, clear vision, and on the right you'll see all of a sudden there's spots, and that would wreck your world, wouldn't it? So now, again, that for many people should be enough. You go, I am going to keep my sugar under control. I had an aunt on my dad's side who was diabetic, insulin dependent, and hated sticking to the diet. Wonderful cook. And her sugar was absolutely out of control. And you notice I'm speaking of it in past tense because she's passed away. And she lost her sight completely from one eye disease to another, all secondary to out of control blood sugar. But she did not, I mean, she was a Southern cook, did not like keeping to what was suggested nutritionally, and did not follow the protocol. Educated woman, it has nothing to do with how smart you are. Often it's by our choices we make. Do not get to the point where your sugar consistently stays high and it damages your eyes.
Is there a cure for that?
For retinopathy, there's surgery, and they will go in and do some laser procedures and clear up those spots. If you wait, and the question was for the web when they look on this online, the question was, can you do some backstepping on this? There are some laser surgeries. So if you have diabetic retinopathy and it shows, and your eye change will be pretty quick, you need to call immediately and try to get into a specialist, and more than likely they will schedule you for some laser surgery. And then that ought to be enough to convince you to really get a tight control of your sugar. But that's what they can do. That was not an option 20 years ago, you know, where we could do some of the stuff that we can do today. There is some other issues with the eye. The lens itself can get very, very cloudy. And when you go in for your eye exam, that might be one of the issues that you kind of go, dog, you know, 6 months ago I could really see well, and now it seems like when I do this with my eyes, one eye or the other seems to have really changed. It'll almost be a cloud. Some people even said that it tints it, almost like it's an orangey color or a yellow color, but they can tell a real difference in one eye and the other. Now, a cataract will cloud up. Good news is there's surgery for this as well. What we've seen is with diabetics, their cataracts form many years earlier. So those of you out there with diabetes, and especially those that do not keep tight control of your sugar, do not be alarmed when that doctor says a cataract's forming, because that's one of the things that can happen. Now, I have already had both of my eyes and cataract surgery on both. Mine was for a different reason that I had cataracts, but still I know the process of what the surgery is like. So but you do not want to have this so early that then there's a problem as your sugar maintains itself high. So blurry vision, cataract, there's surgery for that. And then glaucoma, which is something that you have to stay on top of. And again, I spend a little bit of time on the eyes because I think it's so paramount important with your vision. Even your activity level may change from age 30, 40, 50, 60, 70, 80. Your activity may change. But if you cannot see, it's one thing I choose not to jog anymore, I may walk. It's another thing I can't even walk because I can't see. So vision is something you want to keep as long as you can. Now, and this picture is showing, and we do find diabetics, especially those without tight control of the sugar, can develop glaucoma far quicker than those in the normal population. And there is fluid that builds up. And then this picture illustrates that fluid then building up will cause pressure on the optic nerve, and it will blind you if it's not corrected. So again, any vision changes whatsoever needs to be reported to the doctor. And I wouldn't wait to my appointment time. I'd call and go, I've had a quick vision change, I need to be seen. And the doctors usually, especially if they know you're diabetic, and it should be on the chart, whatever eye specialist you go to, then they will say, you need to come on in. And they would find a way to come in today. So eyes are important. Everybody agree on the eyes? I need to take care of my eyes, okay? Now, I'm going to go down to the feet, and you're going, so what about the feet? I'm not going to look at your feet. I made an executive decision for you not to take your shoes off unless you want to. But what I want to do is go over some absolutes. And you may go, why? You may think, I can take care of my feet. I don't need someone to look at my feet. So what if I get a red spot? So what if occasionally I go barefooted? I know my house. And I will start this by saying, and this has been probably 20 plus years ago, because I was working at a hospital and I was doing a talk on diabetes. So similar audience. But afterwards, there was a young man there that was 30 years old. And he said, Debbie, do you mind staying? I want you to look at my feet. I said, sure. And that was not part of the plan. We finished. He waited till everybody left. And I said, what concerns you? Before we even look, what concerns you about your feet? He said, there is something that's leaking from the bottom of my foot. I said, really? And again, this is before looking. He says, and it has an odor. Now, there are certain infections that have classic odors that you know. And so I said, okay. But I thought, for this one, I may have to put my gloves on. And when he took his shoe off, the sock was so wet it had stuck. It dried and stuck. And it was a raging infection. And the interesting thing was, it was from one little pierced hole, like you might have got from a tack or a nail. It wasn't this raging big cut or slice. It was strictly a small hole that had become infected and bore its way all the way to the bone. And so when you have an infection such as this that gets into the bone, you can lose a limb. And so immediately looking at that, and I knew, and I told him, I said, this concerns me and it is serious, and you need to be seen today. So I got on my little phone and called some diabetic specialists, endocrinologists that worked with the wound care center that did hyperbaric, did all this stuff, and I said, this is a really young person, I'm afraid he's going to lose his foot. And they were able to get him in that day. They did surgery the next day, surgery to clean out a place that could literally heal back. Because you can't put a Band-Aid on that. You got to have tissue that will heal. And there was a lot that was totally destroyed. Now, so what does that say to you? Why did I go to the eyes, to the feet? You've got to keep your feet healthy. And we're going to go over some basic tips. Now, for him, anatomically, he could not bend over to look at the bottom of his feet. And so it's very important, if you cannot bend up your foot to look at it, see all angles, that you have someone that cares about you enough that you can get them to examine your feet. It must be a priority, because one day can make a difference when this issue happens. Now, the good news was he lost 2 toes, part of his foot, but he was able to save the portion of his foot that he could still walk. It could have taken his life. So foot care. So let's look at this, and I'm going to go over today. You go, I may know this, but I want you to think about this every bath from now on. Things to look for. Wash your feet every day with lukewarm water and soap. I don't care if you haven't really gone out and walked a mile and you said, my feet aren't sweaty, I'm going to wait. You need to do this every day, okay? Everybody hear that? Okay, dry your feet well, especially between the toes. And you get a lot of moisture between there, just your feet sweating. But make sure, because sometimes we can have irritations between the toes. Okay, make sure you wash and they are dry between the toes. The third thing is moisturize your feet, but look carefully, not between your toes. So put some moisturizer, top of the foot, the heels, but not between your toes. And more than likely, those of you that are diabetic there, your skin will be dry. That'll be time to lotion up those legs too, because your skin's probably going to be dry. And this is the time to check your feet for blisters, cuts, or sores. So friends out there that are helping each other, you notice you're going to help them after you wash your feet. So the feet is going to be clean. But check your feet. Now, why is a blister even important? Because that blister often, when the skin has already lost its integrity. And so that blister may come loose, and then that is totally open for infection. You don't pick off the blister. You hope that it'll heal on its own. But you check and make sure that blisters, any cuts, any sores. And then on number 5, it says here to cut the nails at a reasonable length. Now what that means is not too short and not to round off, which probably everybody in this room has done before. You got to make sure that you preserve it, because you're going to be more prone to maybe get an ingrown toenail. So square them off and make sure that they're a reasonable length, not too short. But if you get them too long and you have a closed shoe, that can be a problem as well. Okay, wear clean socks that aren't too big or too small. What does that mean? You need to make sure that when you take the socks off that there's not a mark on your leg. Okay, let me say that again. If my socks are so tight, women, if your knee highs are so tight that when you take them off there's a mark on your leg, you need to get a new pair. Now, some companies are trying to market socks that are strictly for diabetics, that are loose fitting and all that kind of stuff, but be careful that the socks are not compromising you. Okay, a couple other things on that. Keep your feet warm and dry with shoes that fit comfortably. Now, good news is insurance now is paying for diabetics to get shoes, and I think you can get shoes to exercise in and specialty shoes. Is it once a year that you can get those?
Yeah, but you have to pay more for them now than you did before.
Well, that's the world we're in, isn't it? Yeah.
I just ordered me a new pair, and I have to pay 20 or 60%, I can't remember which, for the shoe.
Right.
That depends on your insurance.
It depends on your insurance, and if you're on Medicare, and some in here are younger than Medicare age, but do ask your doctor about prescriptions for shoes, and especially if it's a shoe that you're going to walk in, and which I'm going to encourage everybody to do, but make sure you have a good shoe for that. Okay, never walk barefoot indoors or out. I don't care how much you think you know your house and it's carpeted, because that one sewing needle that we had someone come through our wound care center, that she came to the wound care center and did not know it was in her foot. Well, I only went barefoot inside, and it's carpeted, and of course, doing some needlework, it came off there, and she stepped on it and walked on it. So you have to be really careful. Examine your shoes for things that might hurt your feet. We were horrified. Of course, the shoe that we were looking at for the young man that's foot was so damaged. So with that glove I put in there, I wanted to see what I'd find. And there, one in the shoe, in the platform, one of the nails had worked itself through. And so, but he didn't feel it. So that's the reason it had he'd just been walk, 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 walk. And so I urge you that before you put on a pair of shoes, I don't care if you've worn it for the last year, you put your hand gently in there. Our feeling's different in our hands and our feet. We seem to lose it in our feet first. So put your hand in there and see if you feel loose padding that's reared itself up a bit. Even that can cause a blister or a sore. So put your hand in there and find the area. So feet are so, so, so important. But now I'm going to something. Now, I could lose a foot. I could lose sensation. I could, but I'll tell you, you have problems with your heart, you're going to lose your life. Let's see just the odds here. And I'm not doing this to scare you, but to try to encourage you to get on the ball. More than 55% of all deaths in people with diabetes are due to the heart. That's more than half. So if you're all diabetics in here, more than half of you are going to have an issue. So it's worth, okay, I'm getting my sugar better, okay? And heart disease occurs at an earlier age and with a premature death, especially those with it's not controlled. There's so many that are not even diagnosed, y'all. Y'all at least have a concern level and are here. I took care of a patient, a female, who at age 30 came to the emergency room, and she had the symptoms as a heart attack. And you kind of go, no way. She was insulin dependent. At age 30, had a heart attack. Before her 31st birthday, she had open heart surgery. Now that is premature, isn't it? Her blood sugar was absolutely out of control. Some by her choice, in that she ate whatever she jolly well pleased. I'll just give more insulin. Oh, you've heard that story before, haven't you? I don't want to exercise. I like my alcohol, and so she drank a lot. 2-packer, smoking. Now this combination is deadly. So you saw someone that you would, most people would have put off the heart attack later, that had their heart attack, say at 30. So you can make a difference by your lifestyle choices. That's what I want you to hear. You can make a difference by choices you make. So this is going to be important. People with diabetes are twice as likely to have heart disease as those who do not. So we need to really know the following. This is important. You need to know your numbers. Now, I'm going to give you information that will tell you what it should be, but you need to know what yours is. I cannot tell you how many people, when I would say, what's your blood pressure rating? Well, I don't know. My doctor texts it when I go in, but I have no idea. What's your cholesterol? I don't know, but he said it was a little high. You need to be proactive on what your numbers are and really keep up with the results. So let me tell you the 3 most important things. Are y'all ready? It's going to be A, B, C. Easy to remember. A is going to be for hemoglobin A1C. Often they'll just say A1C, but hemoglobin A1C, you need to know what yours is. B will stand for blood pressure. You need to know what it is. Because mine was normal when I was 22, now that I'm 61 doesn't mean it's still normal. I love when people say, oh it was normal, I had it checked last year. Every person at one point may have had a normal blood pressure, but it's all of our folks that are hypertensive today, at some point there was a turn. It might have been a gradual turn where the blood pressure started going up. That is why it's important that you keep up with the blood pressure. C stands for cholesterol is fat in your bloodstream. We're going to talk specifically about a fat that's called LDL, LDL-cholesterol. And that is one that is absolutely lethal. It sticks to your blood vessels. It will clog them up, whether they're around your heart, around your neck, that support your kidneys, to your leg. So I want to make sure that I get my LDL down. I want to make sure my blood pressure is under control. These 3 things, diabetic and a high hemoglobin A1C, a high blood pressure and a high cholesterol is a trifecta of having a huge problem. So I'm telling you what you need to really work on are the ABCs, and we'll go over what that looks like. So now what you're looking here on this slide, the hemoglobin A1C, and what are these little letters up here? That's the American Diabetic Association. Well, they should know what they're talking about. And they say their A1C should be less than 7. Okay? Well, look at the other group. And that's going to be the American Association of Clinical Endocrinologists. What is their specialty? It's going to be any metabolic disease, which includes diabetes and some other things as well. But they're often, if you go to a specialist, it may be an endocrinologist. They say, we want it even stricter. We want it 6.5. Well, I'm kind of, this is Debbie's opinion. This is a side note. So anybody watching it on the camera, this is only Debbie's opinion. I don't want to wait till I get such complications with my eyes and my heart and my legs and my vision to where then I go, oh, I'm going to get tighter on that control now. I'm going to really work at it now. I'm going to really work on getting my blood pressure lower. I'm going to really work on my cholesterol. I want to do it to prevent the problems. Are you in agreement with that? To do it to prevent. So with that, we want to, that's why I lean toward the other end. On blood pressure, the reasons there's a big range here, on the American Diabetes Association, they said, well, 140/90 or less. But if you get into to some physicians, and particularly ones that are endocrinologists, they're saying, we're already working with a cascade of problems. We wanted even a tighter control. And that's the term used, tight control. And with that, they're saying, I would love to get it down to 120/80. Well, Debbie, I haven't had my blood pressure that in 20 years. We've heard that. And for people who've had a high blood pressure for years, it takes a little bit longer for their body to adjust to a lower blood pressure. But just to say that's my normal, 160/100, that's my normal, I've had it for years, that doesn't mean it's right. So anybody that tells you that's my normal, you need to realize that doesn't mean a right or wrong. That is not normal as far as treatment. So this is going to be, again, the range, 140/90 or less, and some doctors even down to 120/80, but taking time, especially if you've had a history of hypertension. Now remember, LDL, and this little thing stands for cholesterol, but this one will be real sticky in your artery. And this is a demon right here. And so now there's 2 or 3 different theories here. For a normal Jane or Joe in the community, will say, ideal is less than 100. We really want you to shoot for less than 100. With diabetes, though, and you may have some other problems like hypertension and other things, we want you to get even lower. If you have any predisposition of other diseases, maybe get down to 70. Well, you're already on medicine, you're on a statin drug, or you're on we want even stricter if you're on medication doing that. So the range can be anywhere from 50 to 100 and going on the downward swing. And I dare say if I did all of your lipid profiles now, I wonder how many LDLs might be over 100. So again, very sticky. And so this is going to be something you really want to work. But again, I'm just saying know your numbers. I want to know what my A1C is. I want to know what my blood pressure is. I want to know what my LDL is. Now, there are some thoughts if in the normal population, non-diabetic, and those who have diabetes, and again, coming from 2 different ways. Remember, we said some of you got your blood sugar checked when you came in for this program. And some of you had eaten, so let's take a look. With the endocrinologist, a specialist that said, I want your A1C 6.5 or less, if you have fasted and before a meal, they would expect your glucose to be less than 110. Now, again, we're just talking to diabetics. So diabetics out there, if you had fasted and when you came in here or was in the morning, we'd want it less than 110. If it's 2 hours after a meal, and many of you just ate within 30 or 45 minutes, 2 hours afterwards, we would want it to start. It may have gone up. We want it to be less than 140. So those of you that do have a glucometer at home, you keep this and kind of know and periodically check. What is your glucose 2 hours after you've eaten a meal and that sort of thing? Now, again, the American Diabetic Association, a little bit different guidelines. They let your fasting or pre-meal 80 to 130. The range is different. And then they're saying keep it less than 180. Again, tight control. I'm having the tendency to go with the ones with lower. But do you see the numbers? Now, I would keep this, and so those of you that do home screening can kind of check and see, gosh, mine is swinging a little bit too much after meals. Your A1C might be gotten every 3 months or 6 months at the doctor's office. The simple blood glucose check can be done at home. Checking your urine for ketones can be done at home with sticks. So those are things to do. Now, let's go. Debbie, you kind of got me wired up now. I'm going to get that sugar down. I'm ready to get at it. What are tests I need to do, and you need to make sure, because I'm telling you, your doctor's not going to come and schedule someone to pick you up and take you in. It's up to you. Wouldn't that be a different world if your doctor called you and said, have you had this exam done? Have you? You know, everybody's busy. These are things, I want you to keep this list, and I want you to date when you have all this done. You should have an annual eye exam. If you have problems, of course, you're going to go in more often than that. If you're 20 years old and your eyes are very good and you're not diabetic, you'll go in every other year. But anyway, so by and large, I need to get my eyes checked every year. Okay? When was your last eye exam? Date it and make sure that you're going in within a year. Foot exam. Now, by your doctor should be every time you go to your doctor, especially whoever's treating you for your diabetes needs to check your feet. If you go in there, he just asks you how you're doing and adjust your medicines and look at your lab work, I'd be just undoing my shoes and saying, I want you to look at my feet. Because that doctor should look at your feet every time they come in. Now, personally, foot exam needs to be daily. You looking at your own feet or your spouse's or a friend's should be daily, but by the physician should be every year. LDL, cholesterol, and triglycerides should be every year. Usually it's in terms of something we call a lipid profile. They'll get a total cholesterol and an HDL and get your triglycerides and get your LDL. And you go, why triglycerides? I can take it to the bank that if you come in and your triglycerides are really outrageously high, I would love, in a normal person, for it to be less than 150. I'd love that. But if you came in, and we've had some, even at church, that we would check their triglycerides, it'd be 300, 350, and I'd go, let me check your blood sugar too, because you can almost parallel it. When the triglycerides are extremely high, often that same person will have a high glucose. Now, sugars can make your triglycerides and your blood glucose go up. Saturated fat can. Alcohol can. Those that drink, and I'm not here to judge, but those that drink alcohol on a regular basis often will have elevated triglycerides. And it does a number on your glucose and your A1C. Just let that be alone. I'm not screening you for alcohol. We had no breath. Okay, we had no breath analyzers when you came in. Am I right? So, but be aware of that. So for those that are challenged with their A1Cs, you need to really consider how much alcohol you drink. Okay, urine test, and again, this can be done, simple test to check for protein. You do not want protein in your urine, and that means we're starting to have some kidney problems. So you want to check that. You want to also do a blood test for creatinine and GFR. This blood test is specific for your kidneys and will show that we're beginning to have problems. You want a blood test for your thyroids, and remember I said especially if you're like me over 50, or if you're that and already have a cholesterol a little bit higher than it needs to be. So these, you need to keep this sheet. You may want to pull that out or write it down and make sure that you record what your numbers are, because you're going to know your numbers and date when you had the test. Liver function test, because this can begin failing, especially the longer we're on medication, and a dental exam. Remember, I'd love to keep my teeth to the grave. Then I don't need them. But you know, I would love not to have certain challenges with that. Again, that's going to be an issue with the blood sugar. Now, another comment real quick, because we'll need to bring this to a close, and I want to make sure you have some things you can do. Now, so we know what tests we need to schedule them if they haven't been scheduled. Earlier, we had talked about in the previous 2 weeks about that what we eat, what we drink makes a difference in our glucose. And we're going to talk about some other things. I'll tell you, we've had people that have started on exercise programs that never exercise that plummeted their A1C and their sugar. It's not a cure, but God designed us to move. He really did. I mean, so it's not a surprise that we function better when we move. I put this because this guy I saw in an interview, but he also was on the cover of a diabetes magazine, and he's a premier cross-country skier. He's also diabetic. And so he's learned to control it. So what I would say to you, as your sugar becomes adjusted, because now I'm starting to get out and walk now, and your sugar you may be seeing is lower, and you may have some dips. So this is to help you control the dips, because you need to know how to do the dips. If your sugar, if you're going, I'm going to go out and do me a 2-mile walk, and you check your sugar, and if it's less than 100, you need to eat a small carb snack before you do it, because it's going to drop more. If your sugar's already 100 or less, it's going to drop more as you exercise. If your blood sugar is between 100 and 250, get your tennis shoes on and get out. It's perfect. If it's greater than 250, you need to check your urine for ketones. If ketones are there, you need to wait until the ketones are out. That is a danger point. Now, what does that mean? More than likely, if ketones are in the urine and you start walking, the sugar's not going to go down, it's going to go up. That's kind of a marker. Okay? So, do you know how to check your ketones in your urine? If not, next time your doctor's visit, say, you know, I need to do this, and there should be a diabetic educator at the doctor's office. If not, ask him. And then, so you want to be able to check. All of us with diabetes, if you have diabetes, you should have a glucometer that you can check your sugar at home, do a quick stick. And you need to know how to do it, as well as a friend or neighbor in case you are ill and can't do it. So have a glucometer, have the capability of checking your ketones. And again, if it's too high, don't exercise. If it's greater than 300, you can also check the ketones again. Don't exercise, but also it needs to drop way within range. Now, if it's less than 70, you might get wobbly. This is a concern I have because I have developed some friends that are diabetics. And my concern is their symptoms of sugar getting low is starting to get a smaller and smaller range, such as, I feel fine. You don't need to check my sugar, Debbie. I'm fine. I'm sure it's up fine. And I check it and it's 40. Why didn't they have the symptoms earlier? And I have found that some long-standing diabetics, that range to where I'm feeling it, I would rather you feel it really quick. And so if it got 70, you're going, oh, I don't feel right, I feel weak, I'm starting to sweat. I'd rather do it then and not get to the point you can't even swallow. So be careful. And if you start having some of the symptoms of a low sugar because of your medication, because of your activities, because of an illness, then you want to make sure that, that you check it and you treat it. Less than 70, and of course you'll stop exercising. These are some of the symptoms. I feel shaky, weak, or confused. 15 grams is what we usually recommend. I would say if you're active, you don't be taking the apple and stuff around this that you might do at home, but rather get some of the quick replacement glucose that you can, it has measured carbs. It can be, look like it's in a tube of toothpaste, it can be tablets, it can be liquid. I find that easier to respond to emergencies here on campus is a liquid. Sometimes they may not have the energy to chew, but they can swallow still. So be very mindful and have that where it's measured carbs, and every time you're active. And if I were diabetic, I would keep it with me in my purse all the time, because you never know. Okay, recheck your blood sugar, 15 minutes, that's the marker. 15 grams of a carb, recheck in 15 minutes. If it's still low, then you're going to repeat this. It's going to be a cycle till you get out of this range, okay? So that's going to be your active, because I want you to get out and get active. You need to know the symptoms of hypoglycemia, and I'm going to run through these quickly because of time. The shakiness is going to be a little bit different than being too high. The sweating, chills, and clamminess, that is a classic difference. Because one that has hyperglycemia, you're going to be left off and seeing them sweaty and clammy. Classic. For someone who has a low sugar, their hair gets wet, they're starting to sweat, they get drowsy, they may get agitated and irritated at you. And if you said, well, let me check, no, don't check my sugar. I've seen the sweetest people in the world get aggravated. And of course they're sweating. I said, you know, you seem to be acting out a little bit, lightheaded, dizziness, sleepy, tingling, numbness, weakness or fatigue, lack of coordination. Some, if the sugar gets low at night, that's horrifying. If you wake up, you're in a puddle of water, and you're confused, and some have even reported crying out in their sleep. Now, if that is your spouse, you need to have that glucometer where you can check their glucose real quick, okay? Your sugar can get so low that you seize. Nervousness, irritability, rapid, fast heart rate, and we've already talked about vision being bad. If it goes really high, you'll be blurred, but it'll be temporary if it gets too low. That's a temporary thing. It's just because your sugar's too low. Now, how important is it to get my sugar back up? There'll come a point where you'll not have the level of consciousness to swallow. And then it's dangerous. The only way I can get it in you then would be if I gave it through your vein. It is going to be very important. And it's going to be important that you mark your medicines around your meal times, and you don't vary much from that. That's why it's going to be important. If you've taken your medicine and it's time to eat, it's time to eat. And I've seen it happen where, and this was horrifying, but he survived. And it was a co-worker at the hospital who was diabetic, and it was time for him to eat. It's no problem. So he gave himself his medication, and we had a code, which means there was an emergency in our unit, and we had to call him out real quick to do some arterial blood work, and we were trying to resuscitate the person, and then all of a sudden I didn't have the results for the blood work. And so I kept patient back to our lab, which was right there, and I said, you know, are you going to give us the blood work? And then finally we just said, somebody go back there, and we went back there, he was on the floor. Okay? He was responding, as he thought he should, to the emergency when we needed him, and yet he didn't have anything quick he could eat. It was something he was going to put in the microwave. And it was done. He could not swallow. And fortunately, we had IV glucose. We could do it. He was wet, and his scrubs were stuck to him. But that is how important it is not to let your sugar get so low that you are unable then to bounce back from it. Okay? Have I alerted you enough? So when it starts getting any symptoms, check your sugar. Just check your blood sugar. Very important. Happy ending, though. He literally got the sugar. He sat up and he goes, okay, let me get the rest of the blood gas. It was crazy. The rebound was really quick, but it could have been horrifying. And know this because diabetics in this room, you will at some point experience this. So know what it feels, sounds like, looks like, and check your sugar and treat it. Mood changes. I had a nursing friend who, she got so mad, and I wasn't like her at all, and I thought, that was weird. And I just said, give me your finger, I'm checking your blood sugar. It was 40. How was she still functioning? I wouldn't want her taking care of me. Blood sugar was 40. Again, that range was very short, becoming symptoms. But mood changes, trembly, paleness, this is a big one. Sweaty, dizzy, getting tired now, and the vision feeling a little bit blurred. Check your blood sugar and treat it with 15 carbs. I cannot tell you on a Sunday morning how many times we've done that. This is such a huge family of faith that we'll have a lot of diabetics that go to church here. And I can't tell you how many times they'll come around and they'll just say, I don't feel right. And I know their history, and I say, well, let me just do a quick finger stick, and we usually have to treat them. So I keep bottles because it's an issue. And sometimes we just get too busy on a Sunday morning and maybe didn't do what we're supposed to before we came into church. Okay, real quick on this other, I would encourage everybody in here to have one of these. Either an ID bracelet, a necklace, you're going, oh, I don't want to do that. Or it could be a card that's very specific that says your history, who to contact, and then your conditions. I'm allergic to penicillin. I've got that on my medical alert card because if I was traveling, I sure don't want somebody to give me penicillin. But you may have some other things. So with that, this is an interesting one. They've got them now where they'll have chips in them, and this will have your whole history and what medicine they need to give you. So they will know immediately that you already have a heart problem and this, that, and the other. So, but I'll tell you, if you were to collapse, I immediately look around your neck and your wrist. And then if I don't see anything there, I'll ask a secondary person, as I'm getting your blood sugar and your blood pressure, I'll ask a secondary person, your witness, if you'll check and see if they have a billfold on them. Looking for the ID. Again, I'm unable to talk. So would you get one of these? When I travel, I have one of those trendy rubberized things that has it inside of it. So they know even internationally who to call, what to look for, and that sort of thing. Just you need to be smart on this. So what can you do in closing? What can you do today? What can you start doing today? Nutrition, 2 weeks ago, 1 week ago, we went over. You can start eating smarter. You got the material. It may be something you need to revisit. You need to eat smarter. And one of those is going to be getting the weight off. We've had diabetics literally that have gone through some of our programs that the doctors had to change the medicine because of the weight loss. That's wonderful. That's wonderful. Or they started exercise and they went, my gosh, we're having to adjust your blood pressure medicine now. Weight control. There's probably very few in this room that would go, I don't need to lose. I'm not interested in losing 5 pounds. Maybe 1 or 2. But most of us would say, I can do that. To exercise regularly, and I don't care if you're starting the program at age 50 or age 60, but to get up and move. To control the blood sugar, and again, I'm going to use that phrase, tight control of the ABCs. The blood sugar needs to be gotten under control. Tight control of your LDL cholesterol. And if you're on medication for any of this, don't say, I'm just going to let the medicine do what it's supposed to do. Your body is taking a toll. Control of the blood pressure. You saw the range. I can't tell you, again, how many people come in and go, but my doctor said that was okay. And I just, And one time spiking up because you're sick and you took something for pain, it can happen. But if week after week after week, your blood pressure and your glucose stay high, you need to seek for a change, either through medicine or through a change of your lifestyle, or ideally both. And then medication control. People say, I don't want to take medicine, I hate to take medicine. It will make a difference. And what best to do is to make those lifestyle changes, get that 10% of your body weight off, get moving, get up, get walking. Again, revisit the nutrition, those things you know that you should eat or not eat, and get tight control and be proactive on these numbers, where you know your history. For years, not just because I'm a health professional, but for years, I have kept a file at home. I know my doctor has one. I want to know. And if I heard it for the longest, it's in the normal range. But when I saw that range, though, going up and up, I didn't want to wait till it got out of range. And just one magical year, they go, I'm so sorry, you're now out of range. I would urge all of you to get hard copies of your medical records, or to write it down when you're in there. There's a lot of people, and a lot of these you may or may not know. I know you know Paula Dean and Tom Hanks and Halle Berry, who does a big advocate. We've got Chicago Bear quarterback that presently living with type 1 diabetes very successfully, and very strong athlete. And of course, this is a young person, but a singer, and a lot of these you may know. The Omnipod is one of the new gadgets that's going to be out that you may be asking for one day, but the way to deliver insulin has gotten so sophisticated that the next generation within a year is going to be something that you need to ask your doctor about. You can both live and thrive with diabetes. That's good news. But let me tell you, I'm putting it back on you, because it's going to be up to you to be ever a partner with your doctor in taking care. I thank you for coming tonight. I hope this encourages you, and that you'll be proactive in making your choices and living with diabetes. Thank you.